A keloid is a type of raised scar that grows much larger than the original injury to your skin. It happens when the body produces too much collagen during the healing process of a wound. Unlike normal scars, which usually flatten out and become less noticeable over time, keloids can continue to grow for months or even years. They may become raised and firm with a shiny, smooth surface. In some cases, keloids can become itchy, tender, or even painful, particularly if they are irritated by clothing or friction. While keloids don't turn into cancer and they are not dangerous to your health, they can still cause emotional distress due to their appearance. Keloids can appear anywhere on your body, but they're most common on the chest, shoulders, earlobes, and upper arms. They can develop after a variety of skin injuries, including cuts, burns, surgical incisions, piercings, acne, and even minor skin damage, such as insect bites or vaccinations. Keloids are a relatively common issue, affecting around 10% of people worldwide, with higher prevalence among individuals with darker skin tones, particularly those of African, Hispanic, and Asian descent. Keloids versus hypertrophic scars. Keloids and hypertrophic scars are both types of raised scars that develop from excess collagen production during the skin's healing process, but they have distinct differences. Keloids extend beyond the boundaries of the original wound, creating a larger, often irregularly shaped scar that can continue growing over time. On the other hand, hypertrophic scars occur when the scar tissue remains within the boundaries or limits of the original injury, but becomes raised and thick. While both keloids and hypertrophic scars are typically raised and can feel firm or rubbery, hypertrophic scars are usually redder and may flatten or go away on their own over time. Keloids, however, tend to remain elevated and don't go away on their own, may appear darker than the surrounding skin, and are more likely to cause symptoms like itching, tenderness, or even discomfort if they form on areas exposed to friction. Causes of keloids. The exact cause of keloid formation isn't fully understood, but it's clear that they result from an abnormal healing response due to a skin injury. Surgical incisions, whether from necessary medical procedures or cosmetic surgery, can trigger keloid formation. Even seemingly minor interventions like ear piercing, vaccinations, or acne can lead to keloids in susceptible individuals. Burns, whether thermal or chemical, are another common cause, as are any cuts, scrapes, or other injuries that break the skin's surface. When the skin is injured, the body begins a process to repair the damage by producing collagen, a protein that helps strengthen and rebuild tissue. In normal healing, the collagen production stops once the wound is repaired. However, in individuals prone to keloids, this process doesn't stop, and the body continues to produce excess collagen, leading to the raised, enlarged scar tissue characteristic of keloids. So, why does this happen? Well, several factors can increase the likelihood of developing keloids. Number 1. Genetics. Genetic predisposition plays a crucial role in keloid formation. If your parents or siblings develop keloids, you're much more likely to develop them too. Number 2. Skin type. Individuals with darker skin tones, such as those of African, Hispanic, or Asian descent, are 15 to 20 times more likely to develop keloids compared to those with lighter skin. Number 3. Age. Keloids are more common in younger individuals, particularly those between the ages of 10 and 30, because the skin tends to heal more aggressively in younger people. Number 4. Location of the injury. Areas with high skin tension, like the chest, shoulders, and upper arms, are particularly prone to keloid formation. This is because these areas experience more movement and tension during healing, which can trigger excessive collagen production. The earlobes are another common site, likely due to the combination of frequent piercing and the unique structure of earlobe tissue. The depth and severity of the original wound can also influence keloid formation. Injuries that extend into the deeper layers of skin are more likely to trigger keloid development than superficial injuries. However, it's important to note that even minor injuries can lead to significant keloids in susceptible individuals. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of keloids. When a keloid first begins to develop, you might notice the area around a wound or injury starting to feel different from normal healing. The skin might feel taut or stretched, and you might experience some itching. This can start happening anywhere from a few weeks to several months after the initial injury. As the keloid develops, the area may feel soft and fleshy, but over time, it becomes firmer and more raised as collagen builds up. Many people describe keloids as feeling rubbery or lumpy to the touch, and the color can vary from pink to red to purple or brown depending on your natural skin tone. The surface of a keloid may appear shiny, and the borders can be irregular, making the scar more noticeable. In some cases, keloids can be itchy, particularly during their initial growth phase. This itching is due to the tension on the skin as the keloid expands. It's worth noting that keloids aren't usually painful on their own, but they can become uncomfortable if they're irritated by clothing or jewelry, or if they're in an area that experiences a lot of movement. In rare cases, keloids can appear without any obvious injury at all, which can be pretty puzzling. And depending on where they show up on your body, they might behave differently. For instance, if you get one near a joint or somewhere that moves a lot, it might be more prone to irritation and keep growing. Another particularly common type shows up on earlobes after piercing. These can be especially noticeable since they're right there on your face, and some people develop what doctors call butterfly keloids on the back of their neck, which can spread out in a pattern that looks like butterfly wings. Some people also get small keloids from minor things like acne scars or tiny cuts. These tend to be less aggressive and might be easier to handle. Then there are the larger ones that can show up after more serious injuries or surgeries. These can be more challenging to treat. Diagnosis of keloids. Keloids are usually diagnosed based on their appearance and the patient's medical history. If a raised scar forms after an injury or surgery and continues to grow beyond the original wound site, a doctor can often identify it as a keloid through a simple physical examination. In some cases, a biopsy may be performed to confirm the diagnosis, especially if the keloid appears unusual or there is concern about other underlying skin conditions. During a biopsy, a small sample of the scar tissue is taken and examined under a microscope to rule out other skin growths, such as tumors. Treatment for keloids. When it comes to treating keloids, there are several options available, and often the best approach involves combining different treatments. Number 1. Silicone sheets or gels. These are products available over the counter and can help flatten keloids and reduce their redness. These products work by creating a protective barrier over the keloid, helping to reduce collagen production and soften the scar tissue. They need to be used consistently, typically for several months, to see meaningful results. The key to success with silicone treatment is patience and proper application. The silicone needs to be in direct contact with the keloid for most of the day. To use them properly, clean the area daily and wear the silicone for as many hours as possible. Number 2. Pressure therapy. This involves wearing special pressure garments or devices that apply constant pressure to the keloid. The pressure helps to break down the excess collagen and prevent further growth. While effective, this treatment requires significant commitment, as you'll need to wear the pressure device for several months, often 23 hours a day, for the best results. Number 3. Corticosteroid injections. This is one of the most common and effective medical treatments for keloids. Your doctor can inject corticosteroids directly into the keloid to reduce inflammation and help shrink the scar. These injections are usually given every 4 to 6 weeks, and you might need several treatments. They work best for newer keloids and can be combined with other treatments. Number 4. Cryotherapy. This involves freezing the keloid with liquid nitrogen. This treatment is usually combined with corticosteroid injections for better results. Cryotherapy can shrink the keloid and help soften the scar tissue, though it is often used for smaller, less established keloids rather than large ones. It can also cause some temporary discomfort and might lighten the skin in the treated area. Number 5. Laser therapy. This involves using targeted beams of light to reduce the thickness and size of keloids. Different types of lasers can be used, each serving a specific purpose. Pulsed dye lasers help reduce redness and improve the keloid's appearance, while CO2 lasers can help flatten raised keloids. The number of sessions needed varies depending on the size and age of the keloid, and your doctor will create a treatment plan tailored to your specific case. Number 6. Surgical removal. Surgical removal of keloids is approached with caution because these scars have a high tendency to recur, often growing back larger than before. However, surgery might be recommended in certain cases, particularly when combined with other treatments to prevent recurrence. Typically, surgery is followed immediately by other treatments like steroid injections, pressure therapy, or radiation therapy to reduce the risk of the keloid returning. Other than these treatments, sun protection is crucial when you have keloids. Sun exposure can darken keloids and make them more noticeable. Always use a broad spectrum sunscreen with at least SPF 30 and try to keep keloids covered when possible. Keep the area well moisturized to reduce itching and discomfort, but avoid products that might irritate your skin. Some people find that natural moisturizers like cocoa butter or shea butter help soothe the area. Also, if you're prone to keloids, preventing skin injuries at the first place becomes especially important. You can also use pressure pads or silicone gel pads after injuries to help prevent keloid formation. Now, we want to hear from you. Have you or someone you know dealt with keloids? What treatments have worked best for you, and what tips would you share with others managing keloids? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.